Hello, everyone. It's a great honor and pleasure to be here virtually with you all today. I'm Yiou Wang, a patient with osteogenesis imperfect, a rare bone disease. Starting from 1 year old, my bones seemed brittle. I had 6 bone fractures incidents before the age of 16 when I finally received a diagnosis, osteogenesis imperfect type 1, the mildest form of OI, yet it doesn't have a cure. Before the diagnosis, my parents kept telling me that it's okay. It will be okay when you grow up. It's all going to be fine one day. And that made me believe that I were actually going to get better. It was not until later that I realized that it was not going to be okay. The disease would make me different from the others forever. During those days, I locked myself up in my room and just played guitar for days without eating or drinking, as if I was saying goodbye to something. At age 20, I went to Beijing to study law and accounting. During my time there, I learned that the Peking Union Medical College Hospital might have a treatment that can help me with my disease. The doctors there told me that there were 100,000 patients like me in China. Many of them could only lie in bed and didn't even have the chance to go to school or work. But no one had ever given up on the hope of living. Listening to that, I felt ashamed. How could I even have the thoughts of giving up on my life? I later learned that OI was not known to many doctors, and not all families were able to afford the treatment. At that moment, a thought came to my mind. I went back to school and set up an online form that provides treatment information and communication opportunities for patients like me. The form had a very romantic name, A City of Glass. Not long after, more than 300 people signed up and connected through the site. That was 15 years ago. Another rare disease patient and I co-founded the China Doll Center for Rare Disorders. In the beginning, we only had 2 full-time staff, the 2 co-founders. Our first project was to increase public awareness of rare diseases. We visited many communities and universities, handed out flyers about rare diseases to every person we met. In August 2014, the China Dolls and Xinlang Weibo launched the Ask Bucket Challenge in China. We invited many Chinese movie stars, sports stars, and entrepreneurs to join us in the Ice Bucket Challenge and to relay the challenges to their friends. The campaign became viral and we raised over 10 million Chinese yuan within a few weeks. However, the passion and attention to the Ice Bucket Challenge faded away quickly, while the pain and hardship for rare disease patients stay. What we need a platform, an umbrella organization, a foundation that can build networks, initiate collaborations, provide resources, and create sustainability to help people with rare diseases. That is why I founded the Illness Challenge Foundation in 2016, aiming to providing medical, social, and financial assistance to rare disease patients and their families. Our foundation offers help to the patients directly through our Rare Disease Medical Aid Fund, supported by public donations and charities. As of the end of June 2021, a total of 1,043 patients have received financial assistance from the fund with a total of 15 million Chinese yuan for their treatment and care, covering 29 provinces across China and 61 distinct types of rare diseases. Meanwhile, we offer help to rare disease patient groups, guiding them through the steps of creating their own patient organizations, help them identify the most contingent problem that they need to work on, and collaborating with them to increase the social impact of rare disease patient organizations, promote public awareness, and advocate policies at city, province, and even national levels. Today, we provide a variety of services to support more than 100 rare disease patient organizations in China. Every year, we host the Rare Disease Symposium on Collaboration and Communication in China. Through the symposium, the patient organization can engage with important stakeholders for rare diseases, including doctors, hospitals, enterprise, the government, and the media. In 2019 and 2020, the symposium was attended by more than 2.7 million participants in person and online, and received coverage by more than 300 media. In addition to helping other patient organizations, we also maintain long-term collaborative relationships with many key stakeholders. Our years of experience allows us to see and analyze problems from the patient's perspectives and to provide suggestions and solutions centered on the patient's needs. We conduct patients' experience and outcome survey, publish research reports and policy briefs, and advocate policy changes via public health campaigns. Over the past decade, our team has grown from just 2 to more than 20 full-time staff, from focusing on just OI to many rare diseases. We have raised nearly 100 million Chinese yuan during the past 5 years, provide service and support to more than 200,000 patients and families, and offered empowerment training workshops and financial support to over 100 patient organizations. We organized more than 80 public events with more than 100,000 participants. We produced more than 30 short documentaries with 80 million viewers. I am Yiou Wang. I am the founder of China Doll Center for Rare Disorders and the founder of the Illness Challenge Foundation. Today, I'm more identified with my role as the members of the rare disease patient advocacy groups because I know how important it is for us, patients and families affected by rare diseases, to work unitedly, to fight with a better life. For decades, I have seen too many children leaving the world without even have the chance to be treated. I have seen too many families had to give up because they could not afford the treatment. I have seen too many mistreatments on the unhealthy us by the healthy others. It now becomes my mission to let more patients like me know that they can be treated, they should be treated, and even when there is no treatment, they should be treated by others properly and respectfully. Every one of us deserves to live a free, independent life with dignity. That is why I'm here today. I want to help patients like me living with rare diseases be heard and seen. We are a group of people who never give up. We live. We chase our dreams, no matter what. Thank you.